Hello, my name is Jane Beasley. I'm the QI lead at North Staffs Combined. Warm welcome to you to this Combined Minds talk about quality improvement. Now, quality improvement, or continuous quality improvement, as we like to think of it, has been around at Combined for a while now. And so some of you are well versed in QI, but just in case you are not, I've got a short video here for you to bring you right up to speed.
In every job, whatever you do, it is important to have a focus on quality and making small steps to make processes easier. Within the health and care sector, we all have a part to play in continuously improving and finding ways to do things a little better for the people who use our services. We call this process quality improvement, or QI for short. So you might be asking, what's quality improvement got to do with me? In a nutshell, it's everyone's job to improve quality, and this is most effectively achieved when it engages and is led by both those working in the service and the people who access and experience those services. This approach ensures we can identify and generate ideas from everyone's perspective. To help with this, we use a QI approach, using small changes in our everyday work to make big overall improvements over time. Quality improvement isn't random, it's carefully planned, and it's your chance to make a difference. It involves listening to the voice of the people who will be impacted by the changes and working with them to reach an outcome that benefits everyone. QI is a recognised method for developing, testing and implementing changes so that improvements can be made quickly but in a planned way. There are often competing pressures within services, and it can be tough to think about improving when our working day already feels pretty busy. But the point is, we're not always talking huge, complex projects. Often it's the smallest changes that can have the biggest impact. Some examples of small changes that can be made to improve quality are text reminder services to help people attend their appointments on time, working with teams on the way they share information about their patients, changing the ordering process for medical equipment to better monitor stock levels and think more sustainably about our waste, improving signage across sites to make it clearer where someone needs to be for their appointment. The changes we make should be thoughtful, meaningful and become part of our routine. We want to work with people who access our services and focus on what matters to them. So how do we actually make things better in practice? Quality improvement first started in manufacturing years ago and moved into the health and care sector more recently, so we can learn from the experiences of other organisations. One good example is the model that the Institute for Health use. This model says that when we're thinking about improvement, we should ask 3 questions. What are we trying to accomplish? How will we know that a change is an improvement? And what changes can we make? These questions all make up the model for improvement, and the answers to the questions help shape the next steps that need to be taken. Essentially, we make a plan to do something, we try it out, see what happens, and then act on the result to tweak things the next time around. The trick is to keep testing and learning, to build up lots of small changes that add together to make a big difference. The effect of this can be really significant and benefit patients across organisations and beyond. We hope that by showing you how simple and effective implementing QI can be, and by highlighting how we all have a role to play in improving quality, that you feel inspired to give it a go. If you have liked what you've heard in this video, there are plenty of opportunities for you to get support, learn more and start putting your learning into practice.
Okay, so that video has been produced by our team here at Combined, and I hope it's given you a few insights into quality improvement. So first of all, I just want to share a little fact about me. I think if you cut me through the middle like a stick of rock, I think you'd see quality improvement written inside me. It's in the very heart of me, and it's part of all that I do. Always looking for how we could improve better care for families, better care for patients and carers. And I think that at Combined, what drew me to this organisation is that when I arrived here, actually there's already a lot of improvement going on. There is a lot of activities. So for the QI team, it's been a dream. And as you can see here, we've got people training in QI, we've got our preceptees, we've got our foundation in leadership and management colleagues, we've got big events like Motivating Combined. So lots already going on, lots and lots of energy. And of course, you will never find the QI team without a post-it nearby. So what is it all about then? So at Combined, the way that we frame QI is all about what matters to you. It's about giving you the tools and the skills and the permission that you need to make the changes that you see need to be made. It's that strong belief that those people in our front line are the observers of what needs to change, alongside the people that use our services. And yeah, I know we very often feel like we're too busy to improve. But QI gives us that opportunity to do this a little easier. Because if we look at this quote here, if you always do what you've always done, you'll always get what you've always got. And so what we can now see across Combined is that improvement culture is starting to embed. It's a ethos, if you like, or a philosophy. We have big ticket items, so we call these QI projects, where there are a number of people involved, many teams, maybe it's across organisational boundaries, a little complex maybe. And then we have smaller ticket items where we're focusing on what really matters to you. The pebbles in your shoe, the changes that you can make, the challenges that you want to overcome where you work, in your ward or in your team. So if we look at this project, for example, it's a classic example of what mattered to Linebrook here. And as you can see, in this team, they wanted to reduce the time between that referral coming in and triage in order to hit that referral to first assessment time. Really important to patients and really important to those that are caring for them. So they went about this project and they've instilled the spirit of improvement in all that they've done. And as you can see over here, they've hit that target. They've hit the target with those key results. And they're learning. They are a true learning team as part of a learning organisation. And they're going on now to look at the next things that they can do. So I think that this instilling of the spirit of improvement into all that we do is evident in this quote here. In that circle, you can see that it's not until change making becomes part of all that we do, in all parts of our work, in our systems, in our teams, that's what they mean by that, that healthcare will attain its true potential. And at Combined, you will know from the video, you'll have got the inkling, that we use the model for improvement. This is our route map, this is our guide. And it asks us, what do you want to accomplish? By how much, by when? And what will you measure to demonstrate impact? This is really important because we want the best value, that's the best quality within our available resources. And what changes can you make? What ideas will you generate with your team and test them out on a smaller scale as possible? Learning really fast. And those little ticket items, those changes that you will bring about with your team, they connect, don't they? They connect to what is sometimes referred to as our system drivers, or those organisational structures that we have. So you'll recognise some of these here on my right. We have our patient safety incident response framework known as PSERV. And at the end of all of that, and all of that response reflection, there's potentially a QI project in the making. Triangle of care and culture of care, all focusing on what matters to you, what matters to your patients and families and carers. What do we need to do and how can we enact that change? Well, the default method is that model for improvement and is QI. And also here we have our trust priorities. In order for us to deliver those, of course, we need to be focusing on the things that are highlighted through our CQC preparedness and focusing on what matters to you. So people say to me, well, how do you do that, Jane? And I say, actually, it's really easy. The hardest thing is getting the energy and having the insights and the ideas. You already have them. And all we do is put a QI thinking against that. And you can see this in this What Matters to You template here. You can see, you'll state the problem, you'll have a look at what's really going on, what's the data telling you, and what's your aim? In order to write an aim, you need to understand what's really going on. And then with your colleagues, you'll generate some ideas and you'll test them on the smallest scale possible. Learning fast, possibly failing fast and moving on. Spotting anticipated benefits. Following that plan, do, study, act cycle. It's quite easy. If you've got the ideas and the energy, this thinking is easy to follow. And a final point, or quite close to the end of this combined minds conversation that I hope we're having here, although you're not talking back to me, I know. QI is half art and half science. So the art of it is the people part. We have to bring people together. They have to feel psychologically safe to put forward their ideas. So we have to create that environment. We have to have shared purpose. And the icing on the cake, of course, is to co-produce this with the people that have lived experience. The art of bringing people together. And then the science. So the science is all about how will we know the changes and improvement? What impact are we having? What are we measuring? What's the measure in the aim? What other things should we or could we measure? So that we can see that our changes, once put in place, will make a difference over time. So there's plenty of support available. We have a QI network at system level, and these are quarterly. It's a learning and sharing environment. And part of the reason I'm here today is it's about telling stories. It's about the stories of the successes and the things that don't go so well, sharing our learning across our organisation and system. So we have a programme of support. You can see it here listed, and we encourage you to come forward and contact the QI team, and there'll be a list of contact details at the end of this video. So finally, it just remains for me to say thank you for lending me your ears for certain, and maybe your eyes if you're not typing on your computer right now. And I look forward to seeing you soon. Bye for now.